Hi everyone. So I want to talk about the symptoms I had before I was diagnosed with breast cancer. That was in 2019 when I first found a very tiny lump. It was painless and movable on my right breast, somewhere up here. So the next morning I went to hospital. I saw the doctor. He said I'm going to do biopsy. Then I proceeded with the biopsy. So when the lump was removed from my breast, it was taken to the lab to be tested. So after some testing, he said it was fibroabnormal, that it was nothing. So I was fine, I was okay. My chest was actually, because I was worried that I can't be having cancer at this young age. So but then again, when the stitches I got from the biopsy healed up, the lump came back on that the same spot. This time it was more bigger than it was before. I went back again. I complained to the doctor. This thing is still here. What happened? The doctor said maybe there's no removal of them before. I proceeded again to the second biopsy. That one should be in 2020 because I did the first one in 2019. I removed it though. They took it to some lab again. It was nothing. Okay. I was saying I'm fine and okay. Then the thing healed up again. Exactly that the same spot. It came back again. And it kept coming back more bigger than it was before. I said maybe this doctor doesn't know what he was doing. Let me try another hospital. I'm staying in Anambra State, so I have to go to Enugu because my friend was now saying she did it somewhere there and the doctor was okay and he don't come back again. So I decided to try her doctor. I went there. He did the same thing. He removed the lump, everything. It be like saying that third one what I do. As in was the generation of my problem, because after I removed the third one, the thing now came out more bigger, and there at that time it now took my nipple inside. The more it was bigger up here, there was lump going through, and the lump was like it was even going into my armpits and so many places. So this point now, the thing started to pain me, like I was having a kind of needle pain inside my breast. Most times when the pain will come, it will now pin me in one place, like I cannot move. I have to wait for that pain to go away before I can start where I was going. So it was like this. I was complaining at home. I was complaining more of, they will now say pray about it, take your mind off this thing, it's nothing, is that. I was praying, but the thing was still there. I was still slimming down. I will eat everything to gain weight, nothing. I was just slimming down. Everybody that knows me back in the days will now say, what is it, Chine? Why are you slimming down? What is it? I will say nothing. I was trying different hospitals, going and asking the doctors. They were checking. There's so many things. Then I decided to go back to the first doctor at the initial stage. I said, let me just go back to him again. I went back to the first doctor. This time, the man now told me that this thing was too attached to your skin. I cannot do anything again. You have to go and see someone that has to do with cancer and all that. He now referred me to a doctor in Teaching Hospital in Neri, Anambra State here. I went. So they now took us some sample from the lump that was on my breast to perform another histological test. So when the histological test came out, boom, I was diagnosed with stage 2 breast cancer. From nowhere to nowhere, I was diagnosed. That was February 2022. I was diagnosed with stage 2 breast cancer, invasive carcinoma. I don't know what to do. I started crying. Crying will not solve the problem. The next thing I said is that I'm going to do a surgery immediately. From nowhere to nowhere, I was performing a mastectomy, and 5 of my lymph nodes were removed because the cancer has already affected 5 of my lymph nodes. So that was how my journey with breast cancer started. And most times I'll be thinking, maybe if I have noticed that lump at that time, I noticed it and I did not even bother removing it and all that, maybe this thing will not have happened. But I was someone that was also conscious with my health that even if I have headache like this, I have to go to hospital to buy to know the drugs I'm taking, because I don't just go to walk into the pharmacy and recommend drugs for myself. I just go to hospital, let doctor recommend it for me, because that is their work. So I was someone that was very conscious of my health. I wasn't living a very bad lifestyle. I was not smoking. I wasn't drinking. I don't know what caused the lump. I don't know what happened, but I was diagnosed with breast cancer. So many people will say it's your lifestyle, is maybe your history. None of my family members have history of breast cancer. I wasn't living a bad lifestyle. I wasn't drinking alcohol. I wasn't smoking. I wasn't doing anything bad. I don't know what caused it, but I was diagnosed with breast cancer. So after the surgery, I started chemotherapy. That my chemotherapy in 2022, that is actually a very worst experience of chemotherapy. I will still talk about the kind of experience I had with chemotherapy, because the first doctor that treated me was not an oncologist, he was a surgeon. And I did not even know that the doctor that treats cancer is an oncologist. It was even last year that I learned to know that a doctor that treats cancer is called an oncologist, because the man that treated me initially at Nehru Teaching Hospital was not even an oncologist, he was a surgeon. And he was perfect with being a surgeon, because he was good in surgeries. The one he did on me was very perfect and okay. I give him credit for that. But but when it comes to treating cancer, he wasn't perfect with it. I have a very bad experience with his chemotherapy. That was why I was afraid when they said the doctor, my new oncologist, said that I'm going to take chemotherapy again. That was the reason why I was afraid of chemotherapy, because I thought I'm going to die. Because the initial experience with chemotherapy, was very bad. I felt like I was going to die. I had a very bad experience. I was to talk about my experience with chemotherapy my first time. That's why I'm just saying, once you find anything on your breast, lump, anyhow it happens to be, make sure you go to a good hospital. And when you're going, make sure you see an oncologist. Don't just see any doctor. Don't just walk into any private hospital and complain. Maybe that was what happened to me, because the first time I started all this thing, it was a private hospital. Had it been I had seen an oncologist, maybe I wouldn't have gotten to this stage. But life happens. Being in Nigeria has many bad benefits of it, because so many people walk around with, I don't know, but being in Nigeria has been a bad thing to so many of us. Nigeria have happened to so many of us, but I'm still here. Thank God that I survived all those baths. I'm still here, and thank God so far my treatment is working. All the side effects from the cancer that I had before I started this chemotherapy the second time, I thank God that almost all of them has disappeared. So I'm just trying to tell you out there, as a lady, once you notice anything that has to do with your breast, no, it's not all breast lump has to do with cancer and all that, but once you happen to have anything on your breast, make sure you see an oncologist. If it's not cancer, you are going to know by the series of tests you are going to do. If it is cancer, you are going to know by the series of tests you do. Don't just walk into any hospitals. Don't just go to any hospital. Just make sure you go to a good hospital. And make sure make sure you tell them that you want to see an oncologist. Don't just go and see any doctor. I'm speaking from experience. I'm a victim here. I know what I've been passing through. So make sure you see an oncologist. Thank you.